India reported 10,929 new Covid-19 cases, 14.14% less than yesterday, as the tally mounted to 3,43,44,683. The toll rises to 460,265 with 392 new fatalities. The Indian Council of Medical Research reported that 613,965,751 samples were tested for COVID-19 up to 5th November this year. Of these, 810,783 samples were tested yesterday itself. The daily rise in new coronavirus infections has been below 20,000 for 29 straight days, and less than 50,000 daily new cases have been reported for 132 consecutive days now. The daily positivity rate was recorded at 1.35%. It has been less than 2% for the last 33 days. The weekly positivity rate was also recorded at 1.27%. It has been below 2% for the last 42 days, according to the Health Ministry data. Meanwhile, COVID and bad air quality could be linked, experts have said, as the air quality of the national capital plunged to severe following the festival of Diwali. Experts warned that it is dangerous for the elderly as well as COVID-recovered patients. Speaking to ANI, Dr. Ashok Seth, Chairman, Fortis Escorts Heart Institute, said, "These are really dangerous levels of AQI, especially dangerous for the elderly and those with lung problems and heart disease. Pollution itself leads to chest congestion and bronchospasm. Those with asthma, bronchitis will start getting worse. It itself predisposes to further chest infections, viral infections, and cases of pneumonia. We see a lot of these happening when pollution rises."
This is really dangerous levels, and dangerous especially for the elderly, those with lung problems, those with heart disease. And if this carries on, we're going to actually start seeing in the next few days problems related to this. Clearly, the first people who get affected directly with such high levels is the ones with the lung problems and our elderlies, because pollution itself leads to chest congestion, leads to bronchospasm. Those with asthma, bronchitis will start getting worse. And also that itself predisposes to further chest infections and viral pneumonias. And we see a lot of this happening when pollution rises. And asthma gets worse dramatically. So elderlies are at biggest risk. The second group, which will gradually come in, is that we, along with the chest infection in the elderlies, many of them have heart problems also. They have blockages, etc. And those seem to get worse.
Subscribe to Oneindia channel and never miss an update.